Hey, denture peeps. I have been wanting to talk about this. This is Summer's comment. What's your input on 3D dentures? So, 3D dentures, I think, are the wave of the future. I think that this is probably going to be something that is huge in processing dentures and making dentures. But let's talk about it, okay? So, when you do impressions conventionally, the way that I do impressions, the way that they call them analog dentures, the way that we make dentures, the way that we've made dentures for many, many moons is called analog dentures. We take impressions with in your mouth with a impression material. There's many different types of impression materials, and that captures the anatomy of your gums, and we pour up a plaster mold of those, and then we build the denture in wax. We do a wax try-in, and then we process that into a multi-level plaster mold in a flask, and you guys have seen me on here finishing those dentures. So that is the kind of the old-fashioned way, analog dentures, and it has been a way. It's called the lost wax method for many, many moons. But now technology is evolving, and they have 3D dentures. So here's my take on it. It's something that I am wanting to learn more and more about because I think that it is going to be the wave of the future, something that replaces analog dentures to a certain extent. So, when you do 3D dentures, there are certain techniques, and some of these are used all of the time, some of these are used with part of the process. So, let me explain. So, one of the things with 3D dentures is typically they are using a wand, a scanning wand, an intraoral scanner that they're putting in your mouth, and they're scanning the inside of your mouth and your gums and your oral tissues. So there are some drawbacks to this, in my opinion. So when you take an impression with conventional impression materials, you're putting a material in here or in a tray, and you're putting that in the mouth, pressing it up. And when you're doing that, it's displacing the soft tissues out of the way and giving you a picture, an impression of the patient's gums. And then we'll make a custom tray with that mold. So we'll take that, pour it up into a model, and we will make a custom tray. And with that tray, we'll use another impression material that captures even more, anatomy. So you're kind of talking about something with the texture of maybe like marshmallow, the marshmallowy, fluffy stuff with the first impression. So it captures a big picture. Then you make a tray from that, and now you take another impression, and that is more of like a honey-like consistency. So it flows into every little crease, every little crevice in the mouth and captures all those fine details. Then you make the denture with that impression mold. So when you're taking impressions with a intraoral scanner, there can be folds in the tissues and soft tissues that are compressed together. And when you're scanning that, there's really no way to kind of push away that tissue and get a really good picture of the ridges. I think maybe in patients with really good anatomy, tall ridges, big ridges, maybe that will work nicely. But with patients, which a lot of my patients are older, they've been wearing dentures for many, many years, and they have a lot of folds and a lot of loose tissue in their mouth. So I would not feel comfortable taking an impression of them with an intraoral scanner because it would capture all their tissues kind of wrinkled together, and that would not give us a good impression for a denture. So that's one of the things that kind of comes along with 3D dentures is this intraoral scanner. But I think that they're going to get it right. I think that technology is evolving and it's very promising. And for some patients, it would work great for, but in others, not so much. So I'm kind of coming to a place in my field where I want to learn to do the digital dentures, the 3D dentures, And in some cases, I think that that would work. And in some cases, I would still have to do analog dentures. The other part of 3D dentures is just the manufacturing process of printing this denture. So 3D dentures, and this is really what it comes down to, is that they are printed by a 3D printer. Okay, so when you are using 3D printing, you are printing this with, like, a kind of a computer machine that is printing these materials. So I feel like you're also losing anatomy with that because it doesn't capture all of the tiny little details in here that you would get if you were making this with, wax and the materials that we're using in the laboratory with regular processing of these dentures. So that's kind of where I'm hesitant to switch over to 3D dentures, is that if you use a 3D oral scanner to get the impression, you're losing some anatomy. Then you're 3D printing that with a machine and you're losing a little bit more anatomy. So I've seen 3D dentures. I've held them in my hand. I have talked to some really big companies that do 3D printing, and they are really looking forward to teaching me, and I'm going to learn. And I'm going to learn to do it in my practice for the patients that it would be appropriate for. And I'm working with a company right now out of Minnesota that, we're talking about it, and they know what my trepidations are, and they agree. And they have told me, in some cases, you will always have to make these analog dentures, that you have to get impressions with regular impression materials, conventional materials. You will have to process them as you always have. But there are some patients to where they're very straightforward. They have good anatomy, they have good bones, and you will be able to use this 3D scanner to do that and then to print them 3D. So that's my take. I'm on the fence. I think that in some cases it's appropriate, and in some cases it just isn't a good idea. I think what kind of bugs me, just to be completely frank, is people often hear of something new and improved in this great big technology. And I see a lot of people on this platform and the other popular platform going, 3D dentures, find a provider that does 3D dentures because those are life-changing, they're game-changing. I don't think that they're there yet to be life-changing and game-changing, and they're certainly not, superior to conventionally made analog dentures. I think that these are more realistic looking right now, and I think that they are much more customized for right now. I think that, honestly, as far as technology and as far as the positives of 3D dentures, I think that that's not really necessarily a huge boost for the patient, except for maybe their dentures could be made faster, but it's a huge boost to the provider if and when they are to where I think that they would need to be. Man, it would save me so much time. It would save me so much time and so much money and so many hours of work of hand setting every single one of these teeth and shaping them and finishing all of this and going through all of this process. Man, it would save me a lot of money and time. But I just don't think that the technology is there yet for every case. So I hope that made sense to you, and there's my take on 3D dentures. All right, have a great day.